The first step was obviously to do some training to explain to the team who these patients were, so the patients at risk, the over 65, patients with long-term conditions like diabetes, COPD, asthma. We also went through, with some of the more junior dispensers, went through a list of the drugs that they need to look out for. That was quite a simple task. And we also flagged the patient medication records. So everyone who had a vaccine last year, they've been flagged as having a flu vaccine. So we can run a simple report and it will show us all our patients who had it last year. So therefore, it's really easy to contact them this year. So there's lots of different ways. We're sending out text messages this year as well. So it's doing lots of things. But I think the key is the staff could identify the patients through being trained themselves. And to be honest, the training wasn't that onerous. 10-minute conversation, that's all it really took. So everybody came in early or at lunchtime. We just had a quick 10-minute chat. I think what we did is we opened at 9 o'clock, so we asked everyone to come in at 8:30, and I brought in a few croissants. Didn't cost very much, but it was quite nice. Everybody just gathered around a table, explained to them what we were trying to achieve, what they needed to look out for. It was a very quick session. And then some members of staff we took a little bit further and put them onto the online training, etc. But it was about raising awareness about what was important to me as a pharmacist, me as an owner, but also to the whole team. I think it's the art of delegation. So the first thing I did is we have somebody in the pharmacy that we sort of call them the coordinator for services. So Ronak coordinates all the services when we make a decision, so delegating some responsibilities to him. But also we have pre-regs, we have senior dispensers, junior dispensers and different members of the team. So we gave each member of the team a role. So my pre-reg last year upskilled all of our staff. Ronak made sure that we signed all the service level agreements and the pharmacists had received the training. And it's about making sure that the whole team is aware of the importance of the service to the pharmacy.
We had to make sure that our consultation rooms were kitted out correctly. We had our indemnity insurance that covered flu vaccines. So consultation rooms consisted of the right sharps bins, vomiting bowls, adrenaline injections, the correct SLAs and PGDs. We maintained the momentum by ensuring pharmacists were updated regularly on where they were with the flu vaccines and identify where we were shortcoming. So if it was a training need, we had a small team meeting to enhance the knowledge, the experience for customers needed to be there, so we needed to ensure all the staff were on board along with the pharmacists.
Well, my boss has promised me a nice meal. If I'll beat what I did last year. I don't know. This year we've done a lot more. We've gone a lot more out in the community this year than we did last year. We're still relying on all our regular patients coming in and having their flu jab. But we're going to be sending out text messages this year as well to all our patients to remind them that they can have the flu jab here. But also we've done more in the community this year than we did last year. And I think that's helped as well.
So promotional materials, we had some banners made, we had some roll-ups made, posters, we advertised on electronic screens, all were simple, with a simple message, have your flu vaccine. We tried not to overcomplicate it to ensure the message was taken on board by patients.
I think sometimes it's just as good to catch them as they drop in. Because most people that you talk to about it, they're all saying, oh yeah, we're going to have the flu jab this year, we just haven't got round to it. And if you can offer it there and then, 90% of them always say, oh okay, then I may as well have it now. The patients want the facts, they don't want any flannel, they want the facts, they want any myths dispelling, they want to know how much it is if they have to pay for it, and if they don't have to pay for it, they want to be able to access it when they want to access it. So if you can keep a certain amount of time free within your pharmacy where you do flu jabs within that designated time, and then patients can come and access it as and when they want to.
Working together, it not only is it rewarding, but also it means that it's more satisfaction for everybody. It's a coordinated service because everybody has their role. So it's more important for me as a business to make sure that every member of the team is engaged, because I'm not there all of the time, and the patients don't just see me as the business, but they see every member of my team. So they know that when they come through those doors, they're going to get a fantastic end-to-end service from the whole team. So it's not just a service pivoted around the pharmacist. And if I sort of was the only person who knew everything about it and kept everything close to my chest, we wouldn't have a successful service. We have to make sure that everybody, right from the delivery driver to the counter staff to the dispenser to the pharmacist doing the injection, all of us are involved in making sure we all have a role. It's rewarding for my staff as well.
I think it's really important. I don't think it's about just dispensing medicine, and I think the way forward with doctors' surgeries is the whole NHS is changing. It's evolving all the time, and I think that they kind of have to interact with each other more now. You don't just go to your doctor to get your medicine and go to your pharmacy to pick up your medication. It's also about promoting healthy lifestyles and healthy living, because all these medicines that we provide for diabetes and for blood pressure, quite often some of it can be helped and controlled by diet, by healthy living advice, and I think it's all, and stop smoking, and I think it's all connected, it all works together.
My top tips to any pharmacist or any business owner would be plan and prepare. That's really important, and engage the whole team as well. In terms of planning, we started our planning way back in February when we ordered our vaccines, but that's not to say it's too late now. But it's really important to make sure that we fulfil the criteria for the service level agreement, the patient group directive, make sure we have the literature, the leaflets, etc. And most importantly, make sure that the team is aware of what you're trying to achieve and involve the whole team. Don't pin the service just on the pharmacist. That's really important, because we all complain as pharmacists that we've got so much to do, and it's so rewarding for the team to be involved in such a service. Offer the service to your staff as well, because once they've experienced it, you'd be surprised at how keen they are, and they feel valued as well, and that's really important. Other things would be make sure your other healthcare professionals are aware that you're there to support them, not to compete with them. Our service, a lot of our patients did feedback to us that they wouldn't have had the flu vaccination if they hadn't had it in our setting. So we talk to our local doctors, talking about how we work together rather than work in competition, because together we can achieve far better results.